Okay. Welcome to Late Night Study with me in the past day. I hope we will have the second episode for this. Yes. The reason for this is because I was so lazy when cramming the whole theory in the textbook or in the PowerPoint presentation slides. So that I decided to recording like this. I hope that when I came back here and I watch the videos, that I can relearn what I have done, like a way to teaching myself. So I'm sorry. And today's videos with the features of okay, minun poika ystävä. Yeah, and we are here in Tampere and we will move back to Pori tomorrow. So yeah. Okay, no more chit chatting. Go straight to our study. So as you can see here, this pharmacology and gerontological nursing care is take care for elderly people, and because they are also taking care from for their medication for their medicines is important. And why we kind of go taking it. Okay, so this is the reason. Yeah, just skip. Uh, Before we start, we have to know the reason why we have to use medication treatment for the elderly. So there are three reasons we have to do so. The first one is to improve their functional capacity when they have any diseases, like for example diabetes and other things. We have to, of course, medication is a part of treatments. We have to use medications to help them. And secondly is improve the quality of life. For example, if they have any depression, so medicine is also a part to help them reduce their depressions and therefore improve the quality of their life. And the third reason is to extend the life expectancies because who don't want to live longer. Okay, and the thing to remember is medications is the small, not just small, not the only part of the overall treatment, because we also have we also need the help of doctors. We need the help of diagnosis. Some disease we have to have surgery. Sometimes we need to taking care from the nurse, and also with some mental diseases, we have to have the help of family, friends, and relatives. Okay, the next, what the fuck is polypharmacy? So polypharmacy is the thing if you're using five more than five drugs in, like for example, they you have your grandma and your grandma have to drink five types of drugs one time, I guess, like a, a big bag of drugs, and this include five of them. So this is called polypharmacy, and this will increase the risk of side effects and can expose to interaction between drugs because drugs is chemical. Okay, because of that problem of polypharmacy, so we have to have safe medication therapy. So the first one we have to know that because they will have interaction, so we have to use it appropriately, effectively, and safely. The second is when you order medicine from the factories, you receive it, go to the hospital, and the pharmacy check it. The pharmacist check it. Doctor prescribe the medicines, and you're the nurse. You follow the medicine. You check if this correct or not. So it means medication should be safety, and the safety should be maintained throughout the chains of care. The third one is all of the healthcare professionals, as I said before, nurses, doctors, pharmacists, all responsible for the patient's medications. And the nurse, like me and you, had to check for the safety and preventing the errors from prescribing medications. We also have to monitor the effectiveness or the side effects of the medications and docu- documenting it. Okay, medication list. Oh my God. It should be up to date, like throughout treatment, and it should be have regular review, maintaining only one medication list only, not like in Vietnam who has a ton of medical medication list, and we fuck up with this and we don't know what should we use to buy medicines. Not a paper one. Yeah, exactly. It should be comprehensive and it should have clearly the informations of diagnosis, drug allergies, and risk information of each medicines. And we should also include the self medications, vitamins, and herbal remedies if it has. And we also have to write those timing of administrations and the form we are going to using it, like in tablet, liquid, or yeah, something like that, and the reason for it. Yeah, so it should be, I think the best way should be e-prescription, electric prescription, not like in Vietnam we have paper and write all the medicine here, and with the handwriting of doctor is so fucking medicine and nutrition. Also the important part of it. Good nutrition support cure of illness and success of medication treatment. Of course, who doesn't know that? And nutrition affect the effectiveness, safety of the medicine, also the chemical things, and the side effect can affect nutritional status. Like maybe the side effect of the medicine could be uh, make you feel like you have a stomach ache, a headache, nausea, and something like that. It also affects how. Of course, when you have nausea, you don't want to eat anything, right? And yeah, so that's just the thing we have to mention about nutrition. The last thing of the introduction is, oh sorry, is self medications and polypharmacy. The OTC ones, the over the counter medicines, make our interactions with each other, and with prescription medicines and herbal preparations. So, as far as I know, the prescription one should be like antiviral antibiotics, and if you use some of the normal medicine, so it may interact, and yeah, better or not, they will have effect. We don't know is that good or not, side effect or good effect. So yeah, be careful. Yeah, so that is the end of the introduction for pharmacologies in gerontological nursing. This is too much. I feel so overwhelmed right now. Okay, we're gonna move to read me number one. Oh, by the way, Phúc, do you have any questions to ask me? My little penis.
How many presentations do you have left?
Three.
Okay.
Beep, beep, beep.
Pharmacokinetics.
Okay, he don't have any questions, so yeah, let's move. Read me number one. The first part, pharmacokinetics in elderly. Well, when people getting older, there are many things happen in their bodies, included decrease in small bowel surface area, slow gastric emptying, increased gastric pH, body fat increase, total body water decrease. So I don't think we just need to remember. No, sorry, we just need to read. I don't think we need to remember. Okay. Sorry, I just have some problem. Okay. So we're gonna move everything here. We just need to read. I guess we don't have to remember so much about it. I was so lazy. So yeah, continue. Okay, we have water soluble medications. When you're getting older, these medication in the bloodstream will increase, and the fat soluble medications decrease at the same time. The elimination of fat. Lab of Vietnamese translation for this because I cannot understand a single word here. Thuốc tan trong nước trong máu tăng và thuốc tan trong chất béo giảm xuống, đồng thời quá trình đào thải thức tan trong chất béo ra khỏi cơ thể chậm lại. Oh, it seems like in Vietnamese is much better. Yeah. And also increase fat. Okay, just skip the English part. Focus on the Vietnamese one. Tăng chất béo làm tăng thể tích phân phối đối với các loại thuốc ươm mỡ cao, ví dụ như là diazepam, chlordiazepam, có thể làm tăng thời gian biến thải của chúng, tác dụng kéo dài. Okay, I just kinda understand that, like half of it. Ooh, half of it. So yeah, okay, let's move on. Okay, the next part important with the second idea, hepatic metabolism is metabolism in our liver. When we're getting older, the weight of the liver is reduced, and the first pass metabolism is also affected by aging, decreased by about 1% per year after age 40. So this means when you're age 41, so it would be more than 1% square. No, sorry, not square. How to say bình phương?
Square.
Square. Oh, okay. La phương is cube. Okay.
Yeah.
So when you're getting 41, it would be 1% square. 42, it 1% cubed. Yeah, something like that. I guess so. Okay. Renal elimination. Serum creatinine level often remain within normal limits despite a decrease in GFR. I'm not sure what is it, so let me search about this. Because older adults generally have less muscle mass and are generally less physically active than younger adults and thus produce less creatinine. So it's just like 50-50. One thing like is so they have less muscle and also they have less physical activity. So yeah. So that is the thing the things of serum creatinine. I have no idea. So let's just learn of it because in the exam they have it. Some of the problems of using medicine is unsuitable medicines. Some may have more side effects and risks than benefits. So therefore we should have a table or a website we do have here in Finland. So it will help us to see if the medicines is good for elderly or not. So it have four ranks. I remember they have A, B, C, D. So A is the best for elderly. B is so so. C is have to consider, and D is absolute no. An an absolute no for elderly people. So yeah, we can use that website to check if a medicine is good for elderly or not. And also remember about what I have talked earlier is the polypharmacies over from different medicine should and prescribed in elderly patients. Yeah, so okay. The final thing of read me part one is psychiatric medications. And remember of the numbers here we have plus okay, also not blood is 37 least one with psychiatric medication, and 12% at least two. So just only remember of the number here, 37 and 12. Okay, we move to the last presentations here. Oh my god. Okay, read me number two. The so in read me number two, we're gonna study about progressive memory disorder. Uh, Although here we mentioned about the most common disease is Alzheimer, but we will mainly focus on the medicine for Parkinson's disease. I don't know why. Oh no, is that the disease for Alzheimer? Okay, let's see. Okay, approx 70% of people have progressive memory is Alzheimer. And medication for it, we have number one is ACE inhibitors, is stand for acetylcholinesterase degrading acetylcholine in the brain. Okay, so this medicines will writing here is boosting the nerve cells in the cortex, and so does enhance their function. So yeah, that is a simple definition for this. So although in the original presentation the teacher didn't mention about the side effects, but I do still write here because in the exam I saw this once and I'm scared it would happen. So yeah. Side effect we have dry cough, high potassium, low blood pressure, dizziness or fatigue, kidney function, and changes in something that I don't know how to pronounce, but it's a serious swelling of face or lips or tongues. I never seen anyone who have that situation actually. Num- the next is memantine, something like that. Inhibits the glutamate neurotransmitter effect on brain cells. Okay, glutamate neurotransmitter. Okay, when the ACE inhibitor begins to decline, some patients will benefit from combining the drug with memantine.
Hmm.
Managing long-term health conditions. Oh, sorry, we had to talk about is what happened to this. Okay, I forgot to delete this slide, so yeah, fucking shit. Mermentine and its side effects, we have dizziness, headache, confusion, constipation, and rarely have hallucinations. So we have some medications for Alzheimer's disease. We just need to remember the name, but yeah, we have donepezil, galantamine, rivastigmine, memantine. Yeah, for name, please do remember this. And we have the principle of medication for behavioral symptoms. The first principle is it will and it is going to bring the side effects from antipsychotics, antidepressants, and analgesics. The second is that the aim for using medication for behavioral symptoms is to treat only one medication at a time, so that would be no polypharmacies and thus no side effects. And the third is psychiatric medications at low dose in short treatment periods of less than 6 weeks. We also have some principle and the psychotics evening base. And remember, haloperidol is not a regular medication. Antidepressant is some medicine in it. I cannot remember. I just write the name here and I don't know what it stands for. Insomnia treatment. Okay, let's see. Okay, our superstar today is levodopa, the most important and effective drug for Parkinson's. Okay, Parkinson's disease is aimed to replace the missing dopamine because the dopamine does not penetrate it into the site of action. The dopamine precursors levodopa is administered. And also, the medication should only be started with a low dose and the dose increase until a suitable action is reached. Uh, this medicine will start to work. It will start to work in 2 weeks. Sometimes take months for the best effect to appear. And we should let the like people who have Parkinson use them 4 times a day in order to achieve the steady state drug concentrations. The side effect will be nausea, loss of appetite, and dizziness. And it should be in a long-term treatment, usually after 3 to 5 years. So it's so long. Moderate change, especially in younger patients in psychiatric symptoms. And the last star of today is the surgical treatment. And all surgical treatment for Parkinson's disease are directed to the central areas of the brains, included thalamotomy, pallidotomy, and intracerebral stimulation therapy. Yeah, and that's it. I hope these information is enough, good enough for the exam, and I hope will be no extra presentation. No, sorry, no extra information needed. And if it needed, so I still hope I can remember. Yeah, and let's see this Saturday if this method work for pharmacology. So if it works, well, I'm gonna do it with the second of gerontological, which is so hard, so struggle, so yeah, so fuck up. So yeah, I hope you in maybe in the future. Gotta say feel happy and understand a lesson better after watching these videos and see ya.